Okay, so today we're going to be practicing some breathing techniques. And this can be used for your patient with COPD, asthma, any sort of like restrictive or obstructive pulmonary issues. So the very first thing that we're going to do is called diaphragmatic breathing. Again, my name is Jessica. I'm a student physical therapist and I'm going to be working with you today.
Okay.
So I know that you've been having some difficulty breathing, so I'm going to try and teach you some different ways that you can breathe. Okay? A lot of times we tend to breathe through our neck muscles and our shoulders, so I'm going to teach you how to breathe a little bit more through your diaphragm. That's going to allow for your rib cage to expand more and get more airflow. Okay?
Yep.
So I'm going to have you lay down on your back for me, head at this end, please. So there's a couple of ways that we can do this. This I think is probably going to be the easiest way for you because you get some feedback, okay, from the table. So I'm going to have you bend your knees for me. You're going to place one hand on your belly, like right below your diaphragm, yep, right there, and then one hand's going to be on your chest, okay? So when you take a deep breath in, your diaphragm flattens out, which expands your chest a little bit, okay? So that's going to be the goal of this. So what I want you to think about is you're going to take a deep breath in through your nose, and then, yep, deep breath in through your nose, just kind of breathe for me. Good, and then back down. Okay, so could you kind of feel that you were breathing a lot through here? There wasn't a lot of movement in your hand?
Yeah.
So what I want you to do now is as you take a breath in, your goal is to try and move your hand towards the ceiling. So you're almost going to try and push your belly out. So we also call this belly breathing. Okay? So deep breath in through your belly. Good. Hand's going to rise and then let it out. Good. And then it's going to fall down. Good. Repeat that for me a couple times. Good job. And I can feel that these neck muscles are staying nice and relaxed. Let's do one more. Good job. Good. Okay. So that would be your regular diaphragmatic breathing. You could progress this by adding like an ankle weight or some resistance, and that can be done in either laying supine or in the sitting position. The way that we're going to progress it today is just in sitting, no weight. Okay, so I'm going to have you go ahead and sit on up for me. Okay, so your legs around. So you're going to do the exact same thing. Okay, one hand on your belly, one hand on your chest. Okay, and as you breathe in, that hand should expand. Good. And then back down, you're getting a little bit of this here. Try again. Yes, good. Good, great job. Okay, rest. And that's diaphragmatic breathing. Okay, so this next breathing technique is going to be pursed-lip breathing. Okay, Dan, so you're having difficulty getting some good air in and getting some good air out. Your respiratory rate is a little bit on the high side, so you want to work on that a little bit, okay? So if you have a hard time getting all the air out of your lungs, this is going to help with that, okay? So what I want you to do is you're going to take a deep breath in, and then when you blow out, I want you to make your lips almost like an O shape, kind of like you're trying to whistle, okay? And you're going to hold that position as you blow that air out nice and slow and controlled, okay? Questions? Okay, so deep breath in for me, and then make an O with your mouth. Good, and one more time. And blow out. So what we're doing is we're doing a slow, controlled release of all of the air that's left in your lungs. Okay, good job. That's pursed-lip breathing. Okay, so the next breathing technique we're going to do is called stacked breathing. Okay, this is to work on your inspiratory capacity, so how much air you can breathe into your lungs before you let it out. Okay, so what it's going to look like is you're going to take just kind of a normal breath. Okay, you're going to hold it for a few seconds, and then without letting that breath go, you're going to take another breath on top of that. Okay, so you're stacking a breath on top of the previous breath. You're going to do that at least 3 times, or as far as you can go, or as long as you can go before you completely run out of air. Okay, once you hit that max capacity, you're going to just blow all that air out. Okay, you ready?
Sure.
So breath in, hold for a few seconds, and then take another breath in on top of that. Good. Hold for a few seconds. And if you can, take another deep breath. Good. And then let it out. Good. Okay, repeat that one more time for me. Good. And then whenever you're ready, yep, good. And one more deep breath in, stack that breathing, good, and then let it out. Great job. Okay, and that's stuck breathing. All right, Dan, so the next type of breathing technique we're going to do is called huffing. Okay? This is going to be a good technique because I want to clear the fluid and the secretions that you have in your lungs. Okay? So what I'm gonna have you do is the very first one, you're gonna take a deep breath in, and then you're gonna blow out really quickly and forcefully. You're gonna make your lips in kind of like a wide O shape, almost like you're trying to fog up a mirror, okay? Or you're trying to like fog up your glasses to clean them, okay? So I'm gonna have you take a deep breath in for me, and then blow out. Good job, okay? So that would be good if those secretions were near the very top of your lungs, okay? Now I'm gonna teach you a technique to do it if they were a little bit lower, okay? This is something that's good for you to be able to do independently, so that's why I'm teaching you how to do it, okay? So if all of that fluid is a little bit lower in your lungs, we need to bring it up to the surface so you can expel that. This is the technique you're gonna do, okay? So you're gonna do the same thing, but rather than taking one breath out, you're gonna take multiple breaths out, okay? So kind of like Lamana's class, okay?
Awesome.
All right, so deep breath in, and then out. Good, nice job, great.
Cool.
Okay. All right, so the next technique we're gonna do is called active cycle of breathing, okay? So it's gonna be sort of a combination of everything that we've already done, okay? So we're gonna do 2 rounds of this, okay? And then the third thing that you're gonna do is gonna be a huffing, okay? So the first thing you're gonna do is you're gonna just breathe normally, just in and out for about 10 seconds, okay? Not a deep breath, just breathe normal, how you would normally breathe, okay? So I'm gonna do that a couple times. And the next one you're gonna do, you're gonna take a deep breath in, and then just let it out normally. You're gonna do that about 3 times. Okay, deep breath in, as deep as you can, and then let it out normally. Good, one more time. Deep breath in. Good, you're gonna go through that cycle again, okay? So normal breathing, in and out. Okay, this can be done several cycles through. Okay. And then you're gonna take a deep breath in and normal out this time. Okay, one more. And after this one, you're gonna huff at the end, okay? Let it out. Good. Good. Nice job. So that's your active cycle of breathing. Ideally, when you do that huffing, you want to do it a little bit more aggressive, a little bit more forcefully. Okay? So I'm actually going to have you do it one more time. We'll just kind of go through. Yep. Good job. Good. Okay. So that would be your active cycle of breathing. Okay, so now that we've done all of our breathing techniques, we're going to do an airway clearance technique. So this is for postural drainage. So the technique that I'm going to show is going to be percussion, and we're going to go over the posterior superior lobe on the left side. So I've got my patient positioned. He's going to be leaning forward a little bit. That pillow is there for more support as he's leaning over, but I don't want it restricting his chest and his lung expansion as we're doing this. So I'm not using a large pillow. I just want something to kind of give him a little bit of support. So with postural drainage, we're going to do percussion. Okay, Dan, so now I want to do another airway clearance technique that's going to help to get that fluid up from your lungs, okay? So I'm going to do something that's called percussion. Percussion is going to be kind of a light, sort of rhythmic tapping on that segment of the lobe, okay? And we're going to do this for about 5 minutes or so, just to kind of try and clear those secretions, okay? So I'm going to make a nice cupped hand. I'm going to go right over that lobe segment. Again, we're doing the posterior side of the superior lobe, and then we're just going to go back and forth just like that. And this can be done during expiration and inhalation, so I don't need to watch his breathing. I just need to kind of make sure that he's doing okay. You doing all right?
Yep.
Good job. And again, you're going to do that for about 4 to 5 minutes. Keep going. Perfect. And that's percussion.